Question: A 40-year-old male presents with a history of fatigue, weight gain, constipation, and cold intolerance. On physical examination, you note dry skin, coarse hair, and a non-pitting edema of the lower extremities. Laboratory investigations reveal an elevated thyroid-stimulating hormone, TSH, level and a low free thyroxine, T4, level. What is the most likely diagnosis in this case? A. Graves' disease. B. Hashimoto's thyroiditis. C. Subacute thyroiditis. D. Thyroid carcinoma. The most likely diagnosis in this case of a 40-year-old male presenting with a history of fatigue, weight gain, constipation, cold intolerance, dry skin, coarse hair, non-pitting edema of the lower extremities, elevated thyroid-stimulating hormone, TSH, level, and low free thyroxine, T4, level is. The patient's clinical presentation, including symptoms of fatigue, weight gain, constipation, and cold intolerance, along with physical examination findings of dry skin, coarse hair, and non-pitting edema of the lower extremities, is highly suggestive of Hashimoto's thyroiditis. Here's the rationale for choosing this diagnosis. Hypothyroid symptoms. The symptoms of fatigue, weight gain, constipation, and cold intolerance are consistent with the clinical presentation of hypothyroidism, which is a characteristic feature of Hashimoto's thyroiditis. Physical examination findings. The presence of dry skin, coarse hair, and non-pitting edema of the lower extremities is commonly seen in patients with hypothyroidism due to Hashimoto's thyroiditis. Laboratory investigations. An elevated TSH level with a low free thyroxine, T4, level is indicative of primary hypothyroidism, which is frequently associated with Hashimoto's thyroiditis. Options A, C, and D are less likely in this case. Graves' disease, option A. Typically presents with symptoms of hyperthyroidism, including weight loss, heat intolerance, palpitations, and tremors, along with specific physical examination findings such as exophthalmos. Subacute thyroiditis, option C. Is characterized by neck pain and tenderness, along with symptoms of hyperthyroidism in the early phase, rather than the chronic hypothyroid symptoms and laboratory findings seen in this patient. Thyroid carcinoma, option D. Would not typically present with the combination of symptoms and laboratory findings described in this case. Moreover, thyroid carcinoma is less commonly associated with these specific clinical features. In summary, considering the patient's clinical history, physical examination findings, and laboratory results, the most likely diagnosis is Hashimoto's thyroiditis, an autoimmune condition leading to chronic lymphocytic thyroiditis and subsequent hypothyroidism. Prompt management and treatment are essential to prevent further complications.